In your morning medical news, 3 FDA employees say the agency's new artificial intelligence is creating studies that don't exist. The chatbot Elsa was supposed to speed up drug and medical device approvals, but employees say the fake studies make it hard to trust the tool. Elsa also can't access many documents needed to determine if devices and drugs actually work.
The main purpose in which it's used, according to many of the scientists that I talk to, is its organization ability. It is identifying a study in the literature, and so it's the responsibility of the scientific reviewer to click on that link that ELSA provides and look at the study and read the abstract.
FDA staff is not required to use AI, despite the Trump administration pushing for more AI usage in the health industry. The government is removing a mercury-based preservative that was already taken out of most vaccines 25 years ago. Health and Human Services now removing thimerosal from all flu vaccines. The CDC's advisory committee recommended this last month. The preservative still appears in multi-dose vials to prevent bacterial contamination, and there's no clear evidence of harm from it. Health Secretary RFK Jr. says the move will protect vulnerable populations from unnecessary mercury exposure. When it comes to tracking steps to stay fit, a new study shows 10,000 may not be that magic number after all. International researchers found moving less can still reduce the risk of chronic diseases and even death. CBS's Tina Kraus reports.
It's the lunch break, but there's no rest for colleagues Lori Othen and Kate Kinning as they chase their daily step goals.
I'm currently on 12,000 today.
I aim for 12,500 a day.
But new research finds just 7,000 steps could be the sweet spot for better health.
People who did 2,000 steps a day, which is a really low number, compared to 7,000 steps a day, the mortality risk was nearly halved in those who were more active at 7,000 steps a day.
Dr. Barbara Jeffress co-authored an international study looking at data from more than 160,000 adults. Those with step counts of 7,000 a day versus 2,000 reduce their risk of many health conditions, including dementia, cardiovascular disease, depression, type 2 diabetes, and cancer.
We could see quite significant and meaningful health benefits.
Should all of us be counting our steps?
I think steps are a great metric that people can relate to, but it doesn't tell us if we're doing them fast or slow, if we're going for a leisurely walk or a more intense run or jog. We must also include some of the activities which raise our heart rate and get us breathing harder to get the full benefit from exercise.
And while some have already blown past 7,000 steps, you guys are kind of overachievers.
Yeah.
Jeffress says progress may count more than perfection.
Not everybody needs to reach 10,000 steps. We can still all do well at a lower level than that.
Every step counts.
Absolutely.
Because researchers found even smaller strides can deliver big benefits. Tina Kraus, CBS News, London.
Good to know. It's hard to reach that 10,000, isn't it? The research published in the Lancet Public Health also found even modest step counts like 4,000 steps a day are still linked to better health.